My name is Jasper Brugts. I'm a cardiologist and associate professor at the Erasmus Medical Center in the Rotterdam, Netherlands. Well, the HFHs is a randomized clinical trial performed in the Netherlands against a very high level of GDMT in background heart failure therapy. And actually it is the first randomized clinical trial of this new technology, CardioMEMS, in Europe. CardioMEMS is a tiny sensor of about a paperclip size unit that can measure the pulmonary artery pressures as a surrogate marker of filling pressures. The HFH is a randomized clinical trial enrolling 348 patients with chronic heart failure in NYA class 3 and 1 previous heart failure hospitalization. And those patients were randomized one-on-one without a sham procedure, so the controls did not receive the implant and they had identical follow-up. The primary outcome was quality of life, and secondary outcome were heart failure hospitalizations during follow-up. We found that the quality of life was significantly improved and also substantial, with 7 points on the Kansas City cardiomyopathy questionnaire, which is substantial. And also the heart failure hospitalizations, total heart failure hospitalizations were reduced by 44% during almost 2 years follow-up. Safety was good. We had 2.3% complications that were mainly arrhythmia and hemoptysis, without severe consequences for the patients. It was just a little bit higher than the US trials, and the reliability of the sensor failures was 1.2. It's comparable to the Champion and the GuideHF trials. One of the beauties of the study is that we have a very detailed medication log file. We know exactly what the doctors did, and we saw that the primary mode of action was changes in diuretics, especially increases but also decreases. It works both ways, so you can monitor hypovolemia and increase diuretics, and monitor hypovolemia and lower diuretics. And probably that will also provide some room for better optimization of GDMT as well. Next step, this was a reimbursement trial for the Netherlands, and the uptake of this technology is low at this moment, with a guideline level of recommendations 2B. Hopefully more patients can get this technology, and the uptake in Europe will be higher than it is currently. But also there will be many fruitful ideas for future research. We have a biobank, serial echo, we will do cost effectiveness and try to develop models for worsening heart failure. There's so much more to do. It's very exciting times, and actually very strong data to do further post hoc analysis.